finalizing our discussion on gender embryology, we began with the first week, then we went into the second week, then we went into the third week. Yesterday we were looking at week 3 up to week 8. Now we are going to look at week 9 up to birth. Week 9 up to birth is known as the fetal period, and this is where the unborn is known as a fetus. And we are going to be dividing these weeks into segments of 3 weeks, so for 4 weeks. We are just going to observe how the unborn changes in structure and in shape. Remember one thing, that between week 3 up to week 8, organs form from the 3 germ layers. So yesterday we saw that by the end of week 8, almost all organs have been laid down. However, they are not mature enough to support you outside the uterine cavity. So the fetal period, that is the period between week 9 up to birth, is a period of growth of the structures which have been laid down from the germ layers. They continue to grow so that by the end of gestation, they are mature enough to support you independent of the placenta. We are also going to see that the unborn in the fetal period is going to increase in length and weight. The weight is going to increase and the length is going to increase because there is growth. It's a period of growth. So that's why the length and the weight are going to be increasing. And that is going to be dependent on the nutritional status of the mother. If the nutritional status of the mother is not good, that will impede the growth of structures during the fetal period. Most congenital anomalies occur between week 3 up to week 8, when organs are differentiating from the 3 germ layers. And in the fetal period, we have very few anomalies which may occur, and they might be as a result of mechanical forces, not differentiation, but mechanical forces. For example, if the baby is improperly placed within the uterine cavity, the feet can bend and invert and lead to a condition known as club foot. However, there are very few congenital anomalies which may arise in the fetal period. Most of them arise when the organs are differentiating from the 3 germ layers. So, week 9 up to birth, we are going to first look at week 9 up to 12. That is week 9, week 10, week 11 up to week 12. That is the first segment of the fetal period. So we are going to be looking at these 2 components plus other features which are going to change. The crown rump length, and the figures here given are average figures within which we have the normal. So crown rump length, here we measure the length of the embryo from the top of the head, which is the crown, to the bottom of the buttocks, which is the rump. We are measuring the length of the fetus from the top of the head, which is the crown, to the bottom of the buttocks, which is the rump. And when you're practicing obstetric ultrasound, you're going to be measuring. Because at a certain stage in the fetal period, the fetus is supposed to be at a certain length as an indicator that growth is taking place. So this crown rump length is going to be increasing as an indicator that growth is taking place. But there are average ranges within which we expect the normal. Those are the ones I'm going to be indicating. And if it is below is an indication that there is diminished growth. The weight is also going to be changing. in an increasing order. So these two parameters are going to show us as we go through the fetal period that there is growth. And the figures which are given here are the average, expected average normal, to indicate that the growth of the fetus is progressing well. So apart from the crown rump length and the weight which are indicating growth, we are also going to look at some structural changes of the different structures of the body which have already been laid down. And that is why in the fetal period, the unborn becomes human-like, because structures are now shaping themselves into their final structure. So between week 9 up to week 12, the average crown rump length is between 5 to 8 centimeters of the fetus. Now it is the fetus, because we're in the fetal period. And on average, the weight can be between 10 to 45 grams, and some machines, ultrasound machines, can measure that. It can be overweight, or the length might exceed the upper limits. But when it goes below the lower limits, it means that there's a problem with growth, or it is maybe we begin thinking about intrauterine growth retardation, whereby there is something which is preventing the growth of the fetus. It might be that it is the fetal demis, it might have died. It might be the nutritional status of the mother is not normal, so the baby is not growing normally. It may be there are some congenital anomalies. That is why these figures of the crown rump length and the weight, it's very important to observe them. And at a certain stage, there is a certain length or weight which is expected as an indicator of normal growth. So between week 9 up to week 12, we are seeing the crown rump length between 5 to 8 centimeters and the weight on average between 10 to 45 grams. So we are going to go on observing these parameters because they're going to increase. At the beginning, the head structures grow faster than the rest of the body. At the beginning, the head structures grow faster than the rest of the body. That is why between week 9 up to 12, the head constitutes almost half of the entire crown rump length. So at the beginning, you're going to see the head half the crown rump length, the entire head almost equal to the other parts of the body, because the structures of the head grow faster than the structures of the rest of the body. But afterwards, we are going to see that the rest of the body will also catch up, and then the head will become proportional. And that is why 9 weeks, between 9 weeks to 12, the face is wide, broad. And when the face is broad, the eyes are separated. The eyes are far apart from each other because of the broad head. But when the head continues to differentiate and its structures grow, the eyes will go to their final position. But at the beginning, because of the broad head, the eyes are widely separated. And the ears can be seen at a lower level than their normal position. That is an indication, but they are still differentiating. And then the eyelids are fused to close the eyes. So we have looked at week 9 up to week 12, the crown rump length, the weight, the structure of the head, other features. The legs are still short, and the thighs are still small. The lower limbs are still differentiating. They have not yet reached their proportional size. But by week 12, the upper limbs will have reached their final relative length. Not their final length, but relative proportional length. But the lower limbs will be slightly shorter. They wouldn't have reached their relative length. So the upper limbs reach their relative length earlier in the 12, between week 9 up to week 12. But the lower limbs, when you look at them between this period, their relative length is not yet achieved. Between week 9 up to week 12, you cannot differentiate between whether the fetus is male or female because the external genitalia are still identical. So you cannot determine the sex of the fetus early in the fetal period. This is not something you have to hurry when you're concluding. Give it time so that the external genitalia can phenotypically be differentiated, then you determine whether it's a male or female. Remember, sex is determined at fertilization, but for you to visualize that unborn, to know whether it's a male or a female, it must be phenotypic external. Because you cannot know the genetic component unless if you screen. But between week 9 up to week 12, the external genitalia are still identical or similar. You cannot distinguish whether it is a male or a female. Now, because the abdomen is relatively small, the coils of the intestines can be visualized outside. Not all of them, but some of them. That's why I'm saying that the intestinal coils are clearly visible in the proximal end of the umbilical cord. And you remember the intestines came from the yolk sac which was absorbed. They continue to grow and lengthen, and at the beginning, around week 9, between week 9 up to week 10, because the abdomen is not so big to accommodate all of them, a piece of them protrudes outside. But by the 11th week, they would have returned to the abdomen because of the increasing volume of the abdomen, so they can be accommodated, so they return back. Why are they outside at the beginning? Because the abdominal cavity has not yet enlarged to accommodate them. But when it continues to enlarge, the remainder of the intestinal coils which remain outside are absorbed. Urine formation begins. It means that now the kidney has begun functioning. Urine formation begins between week 9 up to week 12. And that urine contributes to the amniotic fluid. The kidneys manufacture urine, it goes to the urinary bladder, it is taken out, and it enters the amniotic cavity to contribute to the amniotic fluid. And the urine of the fetus is not concentrated. It will be so much wastes like ours. It is almost watery. Some of this fluid is reabsorbed through fetal swallowing. The waste products of the fetus pass to the maternal circulation through the placenta, and they are taken out. So what have we seen between week 9 up to week 12? We have looked at the crown rump length and the weight. We have looked at the head growing faster so that it's originally larger than the rest of the body. We have looked at the limbs, the upper limbs reaching their relative length, but the lower limbs have not yet reached their relative length. External genitalia, we have seen that between this period of time, they are similar. Intestinal coils at the beginning, they are external but with increasing abdominal cavity. By the 11th week, they return to the abdomen. And then we saw that urine formation begins and it contributes to the formation of the amniotic fluid. That is what happens early in the fetal period between week 9 up to week 12. Are you still hearing me?
Yes, sir.
Yes.
Yes.
Then we go to the next segment of the fetal period, 13 to 16 weeks. At the beginning, we have been looking at 9 to 12. Now we are going to 13 to 16. Look at the crown ramp length and the weight, and you're seeing that here, when we go to the next segment, it is increasing. This is a marker that growth is taking place. You can even use these values to draw a graph. These are average figures. They give ranges within which we must expect. And we have seen that here growth has rapidly increased. Remember, don't forget that the nutritional status of the mother is a very important determinant. Other factors kept constant. At the beginning, between week 9 to 12, we saw that the head was half the crown ramp length. In fact, it was bigger than the rest of the structures because its structures grew faster and earlier. But here we see that the head is relatively small, not because it is shrinking, but because it is differentiating and the other parts of the body are also taking up shape. They are also increasing in their growth. So that the head is no longer half the crown ramp length because it has differentiated towards its normal size. And then the rest of the body, which was smaller, has also picked up or increased the rate of growth. That is why the head between week 13 and 16 is smaller than the head between week 9 up to 12. Limb movements. Movements of the limb. After this course, we are going to be looking at the musculoskeletal system, but we are going to mainly look at the upper and lower limbs. The limbs are the lower limbs and the upper limbs. The upper limbs have the arm, the forearm, and the hand. The lower limbs have the thigh, the leg, and the foot. But when you look and you scan the embryo between week 13 to 16, you're going to see the lower limbs slightly moving. You're going to see the lower limbs slightly moving. This was not happening between week 9 up to week 12. However, these movements cannot be sensed by the mother because they are slight. But when you're scanning, you can see the lower limbs moving. Movement of the lower limbs indicates that the musculoskeletal system is growing normally and the nervous system. Remember, the nervous system is the one which stimulates muscles to contract so that movements occur. So when you see the movements as early as between week 13 to 16, then you know that the nervous system and the musculoskeletal system is progressing normal. And we first observe those movements between week 13 to week 16, but they are not sensed by the mother yet. But you can observe them. You must be very, 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 very observant when you're doing these fetal surveys so that you do not miss anything. So these limb movements can only be visualized on ultrasound. The mother does not sense them because they are slight. And by week 16, ossification would have begun. That is why you can visualize bones on ultrasound images. And then because of further development of the eyes, we shall see some slight movements of the eyes. Some of these are minor observations, you may not see them. The beginning of the formation of the hairs on the head scalp was also observed between week 13 to week 16. And this is very important. Between week 13 to week 16, especially by week 16, the ovaries are differentiated and they contain primordial ovarian follicles that have oogonia. Oogonia are not originally in the ovaries. Oogonia migrate from the yolk sac and they enter the ovaries. And then they get surrounded by those gonadal cells which form follicles. So, by week 16, the ovaries contain follicles. On the inside of follicles, we will also see oogonia, meaning that the reproductive system development begins very, very early in fetal life. In fact, it begins as early as the period of organogenesis, and by week 16, within the fetal period, oogonia have even arrived in the ovaries. Previously, between week 9 up to week 12, the eyes were widely separated. But now, because of differentiation of the head and its smaller size, the eyes come anteriorly to their final position where they are going to develop. So what have we seen? Increase in crown rump length, increase in weight. The head becomes proportional. It's not as big as it was supposed to be. Fetal movements observed on ultrasound, yet they cannot be sensed by the mother as yet. And then ossification by week 16 would have begun. Ovaries would be containing follicles with oogonia, and the eyes would have moved anterior to their final position. The next segment is week 17 to week 20. These parameters are going to increase. For example, you can see previously between week 13 to week 16, we had 9 to 14 centimeters. Here we'll have between 15 to 19 centimeters. Previously, we had 60 to 200 grams. Here we'll have 250 to 450 grams. Increased length, increased weight, a marker that growth is taking place. Of course, growth is not as rapid as it was in the previous stage between week 13 to week 16, but it is observed. Now, this is when the fetal movements are sensed by the mother. It means that they have increased in strength. Fetal movements were observed between week 13 to week 16, but they were slight. Now, because of the increased development of the nervous system and our musculoskeletal system, they become stronger, and the mother can feel them. And when the mother feels or senses fetal movements, we call that fetal quickening. Fetal quickening. It is very important to sense those movements in the specified time, specifically here between week 17 to week 20. By week 20, you must be able to sense movements, because if you're not sensing movements, you have to ask yourself why. Because those movements indicate that the fetus is normal, it's growing, developing normally, and the musculoskeletal system is progressing. The preliminary stages of formation of skin will also be taking place, because here we are going to see vernix caseosa. This is an oily secretion on the surface of the skin of the fetus from the sebaceous glands is observed, and this is just showing us the primary stages of the formation of the skin. And this oily secretion from the sebaceous glands protects the delicate skin from abrasions, chapping or injuries, hardening that would result from exposure to amniotic fluid. It is a protective oily substance secreted by the fetal sebaceous glands to protect the delicate skin of the fetus to give it time to grow normally. And this secretion begins between week 17 to week 20. On top of that vernix, there is delicate hair known as lanugo. This lanugo keeps the vernix in position. So between week 17 to 20, you have an oily secretion covering the delicate skin to protect it, and that delicate hair known as lanugo. And lanugo, the purpose of lanugo is to keep that vernix caseosa in position. All of them are as a result of protecting the delicate skin. We see the formation of brown fat. Fetuses and newborns have brown fat. Adults have white fat. Brown fat is highly metabolic and it produces sufficient heat to keep the fetus warm. So its formation begins between week 17 to week 20. And here I say that by 18 weeks, that is still between week 17 to week 20, the uterus is formed. And then as we saw that oogonia have migrated to the follicles. By week 20, the testes begin to descend from the abdominal cavity towards the pelvis, and from there they will have to descend towards the scrotal sacs. The gonads are originally in the abdomen. They begin to descend from the abdomen down towards the scrotal sacs at week 20. And by birth, they must have reached the scrotal sacs. So we have seen the length, crown rump length, the weight increasing between week 17 to 20, fetal movements being sensed by the mother, secretion of vernix caseosa to protect the delicate skin, and the development of the lanugo to keep the vernix in position. Brown fat developing as the site of heat production, and then we see further development of the ovarian follicles. We also have seen that very important event of the testes, which are originally in the abdomen, beginning to descend on their course to reach their final destination. Don't forget that. The testes and ovaries are originally in the abdominal cavity. They begin to descend by week 20, such that by birth they would have reached the scrotal sacs for the testes and the pelvis for the ovaries. Week 21, these parameters go on observing them, they are increasing. We even get a graph and draw them. And this substantial weight gain between week 21 to 25, remember, don't forget, it is dependent on the nutritional status of the mother. Eye movements are now stronger, and you can sense observe some blinking, indicating that the visual system is developing normally. Now, this is very, 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 very important. Type 2 pneumocytes, you remember them? Those are the cells which secrete surfactant, and the surfactant weakens the surface tension of water molecules lining the alveoli so that the alveoli do not collapse. By birth, you must have enough surfactant to keep your alveoli open so that the fetus or the newborn, not the fetus, the newborn can breathe. But we have seen that the type 2 pneumocytes begin secreting surfactant as early as 24 weeks. Yes, this surfactant may not be sufficient, but this is when it begins to be produced, such that by birth, it is sufficient enough to keep your lungs open so that the newborn can breathe. So the beginning of the production of surfactant is as early as 24 weeks, between week 21 to week 25. And it's a very, very important event. Now, because of that, these prematures born at this stage can survive if given intensive care support. If their lungs are supported with substances that can enable them to mature faster. So the survival depends on their support. Because if you have some surfactant, they can induce the lungs to develop faster and produce more surfactant. And they have a chance of survival. So the survival is a chance survival if given intensive care support. But others die because the respiratory system is immature. So the reason they should be given intensive care support if they are to survive is because their respiratory system is still premature and their nervous system is not yet functional to stimulate sufficient breathing. But if given intensive care support and observed critically for some time, they have a higher chance of survival because the lungs have begun to produce surfactant. So what you have seen, the crown rump length and the weight increasing as a result of progress in growth. Rapid movements of the eyes, they are becoming stronger and more differentiated. Surfactant begins to be produced. And because of that, if they are given intensive care support, they can survive. However, if that is not so, they will die if they are born premature at this stage because their nervous and respiratory system are still premature to support them. That is what happens between week 21 to week 25. Week 26 to week 29, these parameters are continuing to increase. Now it's between 900 grams to 1.3 kilograms. These ones can survive. Their chances of survival if they are born prematurely is higher because the lungs are more developed. They can also be given intensive care support, but the lungs are more developed than the previous ones. The central nervous system is more developed than the previous one. So prematures, their chances of survival depends on the gestational age. The older the premature, the more the chances of survival. So these ones, because of their more developed lungs and nervous system, they have a higher chance of survival. But still, they can also be given intensive care support, but not as much as the previous ones. And survival depends on the lungs and the nervous system. And one of the causes of mortality of these prematures is low weight It's low birth weight. Low birth weight means that the nutritional status of the mother was not good. So this survival of these prematures must also be backed up by the normal nutritional status of the mother. If the nutritional status of the mother is not good, the birth weight will be very low, and that will also affect them. So much as the lungs may be developed by this stage and the nervous system, the nutritional status of the mother must also be good. It also promotes survival of the prematures. The eyelids open, because at the beginning, between week 9 up to week 12, they were closed. These are other minor observations about the nails and then the skin. Week 26 to week 29, the crown lump length has increased, the weight has increased, chances of survival are higher because of the developed respiratory system and nervous system. However, the nutritional status of the mother must be good, so that the baby must be at the normal birth weight. Week 30 to week 38, gestation is 38 weeks. The end of gestation is 38 weeks or 9 months. So this is what we call 38 weeks is what we call term. And babies born between week 30 to 38 are taken to be term. So you can see our crown lump length, and then the weight is between 2.2 kilograms to 3.4 kilograms. However, it might be more than 3.4. But if it is below, that is underweight, below the lower margins. Some of the pupillary reflexes. What a pupillary reflex is when you focus a light onto the eye and the pupil decreases in size. And when you take away that light, the pupil dilates, controlling the amount of light entering the eye. The pupillary reflex can be elicited between week 30 to 38. Here we have talked about the chubby upper limbs. Chubby means they have a lot of fat, because the babies accumulate a lot of brown fat within their limbs. Fetuses between this period survive even without intensive care. Between week 30 to 38, they can survive if the nutritional status of the mother has been good and the fetal growth has not been affected by other factors. When these are born, they can survive even without intensive care. And by 38 weeks, the nervous system is sufficiently mature to control all functions of the body. Growth is not as rapid as it was during the fetal period, but it is still going on. And most fetuses are born at 3.4 kilograms. Here I'm saying that a fetus adds approximately 14 grams of fat daily during the last weeks of gestation. That is why when they are born, when you look at their lower limbs and their upper limbs, they are kind of fatty or chubby because of the increased amount of brown fat towards term. When you look at their chests are so flabby or chubby. They are so chubby because there's so much fat. Babies have so much fat. That is why they look like the way they look, because all that fat increases towards term. Between week 32 to week 36, the head turns towards the cervix, facing the pelvic outlet, and that is what we call a cephalic presentation. Ready to be expelled out at birth. So by week 38, the baby must have attained a cephalic presentation where the baby is facing upside down. The head is the one which is facing the birth canal, and that is the normal orientation of the baby at term. It's called a cephalic presentation. The opposite of cephalic presentation is breech presentation. And breech presentation can lead to failure of the baby to pass through the birth canal. In a breech presentation, the buttocks of feet are the ones which are facing the birth canal, not the head. And that can lead to the limbs being trapped as the baby is moving out. But when the head is presenting first in the cephalic presentation, it will move out very, very, very well. Types of breech presentations will have the complete breech, the frank or extended breech, and the footling breech. And their features are given here. You can see the frank breech, the buttocks are the ones which are facing the birth canal. The head is supposed to be there in the cephalic presentation, but it's the other way around. Complete breech. This is the position which is known as the complete breech, which we have talked about here. The limbs, when you look at the limbs, they are all flexed. And this is the footling breech. The foot is the one now coming out first. These are all abnormal positions. The normal position is when the head is the one facing the birth canal, which is attained between week 30 to 38 weeks. And you must also observe that when you're making ultrasound scans. At 28 weeks, you might still have a breech presentation, but after some time, these babies will go back and attain the cephalic presentation. You must always observe the presentation, whether it is breech or normal, which is also known as cephalic, so that birth or delivery is planned accordingly. The mother cannot push a baby when it is in breech presentation. Parts of the limbs are going to be dropped, and that can lead to injury of the baby as it is passing through the birth canal. Expected date of delivery, 266 days or 38 weeks after fertilization. Now, because you cannot determine fertilization, is difficult. You cannot determine when fertilization took place. It's difficult to count 266 days because you don't know when fertilization took place. So the easiest way of counting these days and estimating the date of delivery is to count 280 days or 40 weeks after the last normal menstrual period. When was the last time you had your normal menstrual period? Then you count 280 days or 40 weeks from there. Then that is the estimated date of delivery. It might be exactly at that date or before, slightly before or after, but that is the estimated date of delivery, 40 weeks after the last normal menstrual period. And I said that approximately 12% of babies are born 1 to 2 weeks after the expected date of delivery. This is not religious. It can be before, or it can be after, or it can be exactly as you had planned. The rest of the notes are going to show you the factors that control fetal growth. We have seen that during the fetal period, the fetus is growing. What factors? What factors? So we're going to go through these other notes I put for you to look at the factors that control fetal growth.